For millions of Americans, Medicare isn't just, a government program. It's really a critical lifeline. It's the foundation of their healthcare. But let's be honest, trying to figure out all the changes, the updates, all the details, it can feel, well, incredibly overwhelming, like trying to untangle a messy ball of yarn.
Yeah, exactly. So that's why we're doing this deep dive today. Our mission really is to cut through all that noise. We want to give you a clear, a concise understanding of the most important changes and updates coming to Medicare in 2025. This deep dive is basically your shortcut to being well-informed. We'll highlight the surprising facts, the practical things you really need to know.
And to give you that shortcut, we've really dug into, well, a whole stack of sources. We're talking official government reports, detailed financial analyses, insights from leading healthcare policy groups, all focused specifically on what Medicare looks like for 2025. Okay, so let's jump right in then. 2025 sounds like it's shaping up to be a pretty pivotal year for Medicare. What makes this year so significant? And, for beneficiaries listening, is it mostly good news, bad news, or maybe like usual, kind of a mix?
It's definitely a mix. I'd almost call it a tale of two halves for Medicare beneficiaries. That's what really stands out. On one hand, you've got some really positive things happening. New cost caps, much better Part D drug plan structures, real progress in negotiating drug prices, which is, well, huge. But then on the other side, you also need to brace for challenges, things like higher premiums, maybe fewer choices in Medicare Advantage plans, and even these looming budget cuts that could affect things down the road.
A tale of two halves. I like that. So it sounds like you might get some relief in one pocket, but maybe feel a pinch somewhere else. Is one side, you think, more impactful for the average person?
It really depends. It depends so much on your specific situation. Like those Part D changes, they're fantastic if you have high drug costs, really life-changing for some. But higher premiums, potentially narrower Advantage plans, well, that affects almost everyone looking for coverage. So yeah, there are good shifts, but you definitely need to be more proactive this year, more engaged in your planning.
Okay, let's unpack this then, starting with the core. Medicare Parts A and B. So Part A, the hospital insurance. Who gets that premium-free in 2025? That's still most Americans, right? People who've worked and paid Medicare taxes for about 10 years or more.
That's correct. The vast majority qualify for premium-free Part A based on their work history or their spouses.
But for those who don't, they're looking at a monthly premium. It's either $285 or $518, depending on how long they paid in. And the Part A deductible that's going up too, right? For 2025, it's $1,676 per benefit period. Can you just quickly remind us what exactly a benefit period means? It catches people out sometimes.
Absolutely. It's crucial. A benefit period isn't a calendar year thing. It starts the day you're admitted to a hospital or a skilled nursing facility. And it only ends once you've been out of the hospital or facility for 60 consecutive days. So the key thing is you could actually face that $1,676 deductible multiple times in a single year if you have separate hospital stays that qualify. It's not like your typical annual deductible. Right, that's a really important distinction. So $1,676 per benefit period, up $44 from 2024. And then for those longer hospital stays, the daily costs start kicking in, and they get pretty significant. It's $419 a day for days 61 through 90. Then it jumps to $838 a day for those lifetime reserve days. And after that, you're paying the full cost yourself. Exactly. And those daily copays, that's where things can get financially challenging very quickly, even with Part A. Part A seems really comprehensive at first glance, but understanding how fast those daily costs stack up is key. A 90-day stay. That could easily mean over $20,000 out of pocket just from those daily charges. And that $838 a day for the lifetime reserve days, that's a safety net, sure, but it's limited. You only get so many of those days over your lifetime. Once they're gone, the costs are entirely on you. It really highlights why supplemental coverage or just careful financial planning for a long recovery is so critical.
Yeah, it's like a meter running on your savings, isn't it? Scary stuff. Okay, let's switch gears to Part B, medical insurance. This covers things like doctor visits, outpatient care. What's the standard monthly premium looking like for 2025? It's $185 a month. That's up from $174.70. And the annual deductible is $257.
Right, $185 is the standard premium. But, and this is a big but, for some, if you have higher income, you'll likely pay more. That's because of something called IRMAA, the income-related monthly adjustment amount. And this isn't just for the super wealthy. It can affect many retirees with decent incomes. Medicare looks at your tax return from 2 years ago. So depending on your income level, your total monthly Part B premium could range anywhere from $259 all the way up to $628 for 2025. It really shows how Medicare tries to balance keeping it affordable for most, while asking higher earners to contribute more to keep the program funded. It's a sliding scale.
Okay, right. Now, let's get to what I think a lot of people are really interested in. Maybe the biggest news. Part D, prescription drug coverage. Is it actually true? Is the infamous donut hole finally gone in 2025? Yes, it is. It's really happening. That's one of the most significant changes for 2025. Remember that coverage gap where you suddenly had to pay a much higher chunk of your drug costs after hitting a certain limit? Well, for 2025, that gap is eliminated. Instead, there's a brand new annual out-of-pocket maximum of $2,000. So what does this mean for you? Once your out-of-pocket spending on covered drugs hits $2,000 for the year, that's it. Your coverage becomes fully comprehensive. You pay zero cost sharing for your covered drugs for the rest of the year.
That is just a monumental shift. For anyone managing chronic conditions, anyone with really high medication costs, this is huge. Hitting that catastrophic phase where you genuinely pay zero out of pocket,
Yeah.
it completely changes the game for financial planning and managing healthcare. It provides enormous relief, real peace of mind.
Yeah.
That fear of unlimited spiraling drug costs is finally gone.
Absolutely. And there's another new thing too, right? A prescription payment plan option. How does that work?
Yeah, it lets beneficiaries spread out their drug costs over the year, so it helps smooth things out, especially if you face big prescription bills early in the year. But just to be clear, it doesn't actually reduce your total drug spending for the year. It just helps with the cash flow, makes payments more manageable month to month. Other key numbers for Part D average monthly premiums are around $46.50, give or take, and the annual deductible cap is $590 for 2025.
And beyond just the payment plan, something else really important is the expansion of the low-income subsidy, or LIS. It's often called extra help. Eligibility is now expanded up to 150% of the federal poverty level. That means more people will qualify for help paying their premiums and lowering their out-of-pocket drug costs. It's a significant boost for affordability. But here's what's fascinating, and maybe a bit concerning. Despite these really positive major changes, surveys are showing that a staggering 87% of beneficiaries haven't even heard about the $2,000 Part D cap or this new payment plan option.
87%.
Right.
Wow. Yeah. It points to this huge communication gap, doesn't it? You've got these vital financial lifelines being put in place, but the very people they're designed to help just don't know about them. It really underlines how crucial it is for you, the beneficiary, to actively seek out this information. You can't assume it'll just land in your lap.
That's truly alarming. If you don't know, you can't benefit. That's millions missing out, potentially. Okay, let's shift over to Medicare Advantage Plans Part C. We're seeing a huge trend here. Over half of all Medicare beneficiaries are now in these private plans. That's about, 33.8 million people in 2024? And another striking thing, federal payments to these Advantage plans are surging in 2025, up 20% per person. That adds up to an extra $84 billion going to these private insurers.
Right. And if you connect that to the bigger picture, here's the paradox. Even with all that extra federal money flowing in, we're actually seeing some of the biggest insurers, like Humana, like Aetna, which is part of CVS Health, starting to scale back their offerings. They're trimming benefits, things that were popular extras like transportation help or allowances for over-the-counter items.
Wait, that doesn't seem to add up. More money goes in, but beneficiaries might get fewer perks. What's going on there? Is it just that healthcare costs are rising so fast they eat up the extra funds? Or are insurers changing their strategy?
It's a bit complex. Rising costs are definitely part of it, yes. But it's also about how these plans manage risk and, frankly, their profitability. There's more regulatory focus from CMS now on plan quality, on marketing practices. The competition is tight. So some insurers might be deciding that certain extra benefits just aren't sustainable if they want to maintain their profit margins. So what it means for you, the beneficiary, especially during that critical open enrollment period, October 15th to December 7th, means you absolutely have to review your current plan. Don't assume anything. You might need to shop around because the benefits you liked could be shrinking or gone, even though the government is paying the plan more.
Got it. So more crucial than ever to compare plans during enrollment. And you mentioned regulatory changes. CMS put out a big final rule back in April 2025. It aimed to modernize Advantage, Part D, and some other programs. Sounds technical, but does it have practical effects for people choosing plans?
Oh, absolutely. Even though it sounds like inside baseball, that rule really changes how plans operate. It affects details around your prescription coverage, how those new payment plans are structured, how plans for people eligible for both Medicare and Medicaid work, even how the star ratings, the quality ratings are calculated. Ultimately, these changes are meant to push plans towards better quality and make things clearer for you, which impacts the benefits they offer and how easy they are to understand.
Okay. Now let's talk policy and pockets. The Inflation Reduction Act, the IRA, it gave Medicare the power to negotiate drug prices for the first time. That was supposed to save huge amounts, right? Almost $98.5 billion over a decade. Sounds like a massive win.
Conceptually, yes. It is a massive shift in policy. But, and this is where it gets tricky, while that negotiation power is active, we need to look at the nuances. How is it actually being implemented? The fine print matters. The 2025 reconciliation law, that's a special kind of budget bill, actually includes some specific provisions, you could call them carve-outs. These delay negotiation for certain really expensive drugs, like the cancer drug Keytruda, and they shield others, like Darzalex, completely from negotiation for now.
So Medicare can negotiate, but not necessarily on all the highest cost drugs right away.
Exactly. And that means some of those initially projected savings, maybe $5 billion or more over the next decade, might not materialize quite as expected because of these specific legislative tweaks. It impacts the overall savings potential.
So some big savings, but maybe not quite the full amount hoped for initially due to these delays and exclusions. That's important context. We've talked about the immediate pluses and minuses for beneficiaries. But what about the bigger picture, the long-term financial health of Medicare itself, especially with this big reconciliation bill you mentioned?
Well, yeah, that 2025 reconciliation bill, while it includes some Medicare items, is also projected to add significantly to the federal deficit, maybe up to $3.4 trillion over 10 years. And why that matters for Medicare is because a large deficit can trigger automatic spending cuts under a budget rule called PO-GO.
PA-GO. Right. What exactly is that again?
PO-GO stands for Pay As You Go. It's basically a budget rule designed to enforce fiscal discipline. It says new spending or tax cuts have to be offset somehow, either by cutting spending elsewhere or raising revenue. If they aren't offset, automatic across-the-board spending cuts get triggered. And in this scenario, those automatic cuts could hit Medicare pretty hard, potentially slicing around $500 billion from the program between 2026 and 2034.
Wow, $500 billion potentially cut from Medicare. Potentially, yes, due to PA-GO triggers linked to the deficit impact of other legislation. So what's really fascinating and maybe worrying is this tension. You have these immediate benefits we've discussed, the Part D cap, drug negotiations starting up, which are great for current beneficiaries. But you also have these long-term financial pressures and potential cuts looming because of broader budget decisions. It's a real balancing act, and the long-term sustainability is definitely a concern for future retirees.
It certainly paints a complex picture, that tension between today's benefits and tomorrow's funding. Okay, for those of you listening who are nearing Medicare age or already on it, let's just quickly touch on enrollment again. If you're already getting Social Security benefits, you usually get enrolled automatically in Part A and Part B when you turn 65. But, and this is super important, delaying Part B enrollment needs careful thought. You generally only want to delay it if you have other qualifying coverage, like from a current employer. Because if you delay Part B without that kind of coverage and sign up later, you can face late enrollment penalties that stick with you, increasing your premiums for the long haul.
Absolutely. And just like we talked about, higher premiums for higher earners with IRMA for Part B. Well, IRMA applies to Part D premiums too. So high earners pay more for drug coverage as well. But crucially, on the flip side, for those who are struggling financially, don't forget about the support systems. Programs like the Medicare Savings Programs and that extra help for Part D we mentioned earlier, they exist specifically to help people with lower incomes afford their premiums, deductibles, and copays. These programs can make a massive difference, but they're often underutilized. People just don't know they might qualify or how to apply. So please look into them if you think you might be eligible.
Great reminder. Okay, so let's try and boil this all down. What does this mean for you, the listener? What are the key action items? First, you absolutely have to review your plan options during that fall enrollment period, October 15th to December 7th. Don't just assume your plan is staying the same or is still the best fit. Things are changing. Second, really explore these new tools. Look into that Part D payment plan if cash flow is an issue, and definitely check your eligibility for subsidies like the expanded extra help. Third, try to stay aware of how drug pricing rules are evolving and how that might impact the cost of your specific medications under your plan. And finally, keep an eye on the bigger picture, those potential future changes coming from the reconciliation law, the possibility of pay-as-you-go cuts down the line that could affect long-term benefits. So yeah, as you can tell, 2025 really is a pivotal year for Medicare. Lots of significant reforms, but also some emerging challenges. We really hope we've helped unpack the crucial details today, giving you what you need to navigate these changes more effectively, more confidently.
Definitely. And maybe just to leave you with something to think about. Given this whole mix, rising costs in some areas, brand new benefits like the Part D cap, but also these potential future budget cuts looming, how might all these moving parts reshape how individuals, how families think about planning for healthcare costs long term? How does it change the conversation around financial readiness for retirement in the next decade?
That's a great question to ponder. We really encourage you to keep exploring these topics, keep learning, and use this knowledge as you navigate your own healthcare journey.